everyone, my name is Mira. Today my group will be explaining about canine distemper virus. Canine distemper virus is a highly contagious viral disease that affects dogs and other members of the Canidae family, including fox, wolf, and ferrets. The virus belongs to the Paramyxoviridae family. This contagious and serious disease targets the respiratory, gastrointestinal, and nervous system of puppies and dogs. Infected dogs commonly exhibit systemic clinical signs such as fever, lethargy, and loss of appetite, along with respiratory signs such as nasal discharge and pneumonia, and also gastrointestinal signs such as diarrhea. As the virus attacks the nervous system, infected dogs develop circling behavior, head tilt, muscle twitches, seizure, and partial or complete paralysis. The virus may also cause the foot pad to thicken and harden, leading to its nickname, heart pad disease.
The canine distemper virus is transmitted mainly via droplet secretions such as sneezing or coughing from infected animal. It can also be transmitted via shared water or football with a healthy and also infected animal. And some of the infected dogs may shed the virus particle for several months. Canine virus induce multiple pathogenic effects due to the different interaction between the viral particle and also the host. It interplays with the immune system, and also subsequently this transient immunosuppression is considered crucial in the development of the different clinical signs of canine distemper virus infection. So after the dog has been infected, it will followed by the replication of the virus in the lymphoid tissue of the respiratory tract, and also the virus is predominantly found in the local tissue macrophages, which will migrate to tonsil and also the bronchial lymph node. So the primary viremia leads to the spread into distant lymphoid and also hematopoietic tissues such as spleen, thymus, lymph node, bone marrow, which will result in lymphopenia and also immunosuppression. So this will provide ground for secondary bacterial infection. So moreover, mucosa-associated lymphatic tissue (MALT) and also macrophages in the lamina propria of the GIT may be infected as well. And the subsequent fate of the infection may depend on the virulence of the CDV strain and also the age of the infected individual, as well as their immune system status. So the failing or insufficient humoral response during this infection period may promote secondary viremia, which will result in the spread of the virus to the various epithelial and also mesenchymal tissue, as well as the central nervous system of the animal.
Hi, I'm Lisda. Now you must be wondering if this disease can be treated or prevented, right? Unfortunately, there is no specific treatment or cure for canine distemper virus disease. And the goal of treatment is basically to manage by symptomatically and prevent secondary infection. And the treatment may include antibiotics to protect the dogs with weakened immune system, IV fluids, palatable, easy to digest food, anti-nausea medication for the gastrointestinal symptoms, anti-seizure medication in mild neurological cases, and the last option is by euthanasia for severe or unmanageable cases. So, is canine distemper disease preventable? Yes, the most effective way to prevent this disease is through vaccination. Canine distemper vaccination is recommended as a core vaccine for dogs starting at 6 to 8 weeks of age, and it should be repeated every 3 to 4 weeks until 16 to 20 weeks of age. The vaccine is then repeated after 1 year and generally every 3 years after that. Infected dogs must be identified and isolated from other dogs to prevent further spread of the virus. Sanitation practices should include good hygiene and thorough cleaning, as most household disinfectant can easily kill the virus. As dog owners or caretakers, you should wear disposable personal protective equipment, including gowns, gloves, and boots when interacting with the infected dogs or cleaning their space. And you you should discard these items and wash your hands before visiting other dogs. By practicing this, you can prevent the virus infection or transmission.
Right, so to diagnose a canine distemper, we can collect the blood for hematology. The results will be showing lymphopenia, thrombocytopenia, monocytosis, and intracytoplasmic inclusion bodies in the lymphocytes and RBCs. Meanwhile, the neonates will be having hypoalbuminemia and hyperglobulinemia. From the radiology, we can observe interstitial lung pattern at early stage and alveolar pattern with secondary bacterial infection and severe bronchopneumonia. We can also perform cerebrospinal fluid analysis to check for presence of increased protein and presence of inclusion bodies in the CSF cells. Another diagnostic workup is by performing immunofluorescence tests for infected tissues, ELISA, and reverse transcriptase or quantitative PCR. From the postmortem, we are able to observe multifocal areas of necrosis and hemorrhage occur in several organs, including the kidney, lungs, liver, brain, and also intestines. Meanwhile, the lymph nodes and spleens will be enlarged. Meningeal encephalitis and hyperkeratosis of foot pad are also common in this case. From the histopathology, neuronal degeneration and gliosis will be found in brains of dogs with neurologic complications. Other than that, we can observe the necrosis of lymphatic tissues, interstitial pneumonia, and cytoplasmic and internuclear inclusion bodies in the respiratory, urinary, and also gastrointestinal epithelium. For declined education, owners should isolate their canine distemper infected dogs with their other healthy dogs in the household and also disinfect the environment of canine distemper infected dogs even though the enveloped virus is rapidly destroyed outside the host. And they should minimize direct contact of their dogs with stray dogs by limiting their outdoor activities.